My name's Laura Rogers. I qualified in 1998 as a physiotherapist and I'm currently working as an AHP Clinical Fellow for Health Education England. I specialised very early in my career. I knew very early on that I wanted to work in musculoskeletal physiotherapy, but I specialised again into shoulder physiotherapy, working and managing the Nottingham Shoulder Unit and working alongside internationally renowned shoulder surgeons. I loved my role as a shoulder physiotherapist. It was quite specialist. There weren't many physios about and I was an expert in my field. But I think I realised very early on that in terms of next steps and where I wanted to go, I was getting increasingly interested and involved in the management sides of the job. I applied and was successful in the NHS Graduate Management Scheme. So it was a big step because I left clinical entirely, and that was quite a difficult move because I loved the job, I loved what I specialised in, but I also wanted a long-term career in management, so it felt like the right move to get a real good grounding and education in management on a fast-track scheme. As a graduate management trainee, I was quite unusual because I was a clinician and management trainee, and probably 80% of my cohort of trainees were not clinic at all. In terms of what that brought to the role, I had a real appreciation of what patients really wanted and how it felt to work on the front line. It incorporated a Master's in Management and Leadership, but it was really about core attributes in terms of organisation, budget management, but also, more importantly, things like policy, wider strategic issues going on in healthcare, and looking at the wider strategic picture. So it really opened my eyes to the next kind of layer of management and how the NHS was structured across the entire health and social care system. For anyone who's looking to pursue a career in management, what I would advise is you've got a lot of transferable skills as an AHP already. I think there was a lot of lack of confidence amongst AHPs about what they can bring to the party. And really, my experience in working with both AHPs and with management trainees is AHPs have got a lot to offer. Please don't be afraid of articulating your opinion, your thoughts about a service or a pathway, and getting involved in meetings at every level. You know, one of the first things I did before I was a management trainee was I got involved in meetings all over the hospital, wherever I could, just to find out what was going on. And don't be afraid to say what you think. You've got a real valuable voice in the conversation, and clinical leadership is so important in today's NHS, and I think we should encourage it at every level. Be prepared for a bit of a culture shock. It is different, and it is a very different environment going from being fully clinical to fully management. One of my biggest culture shocks was spending time working immersed in patient practice and then a few months later walking around a building site with a hard hat on. It really was a culture shock. But if you remember and keep true to your values about why you're doing what you're doing and you're having an impact on patients but just over a much bigger geographical area, then it kind of keeps your resilience up and it keeps your strength up in difficult situations. Because across management and clinical situations, there's always going to be challenging situations with difficult people and difficult conversations. And the skills that AHP have, they've come across this before and you'll come across it again, whereas perhaps some kind of younger, new management trainees may not have that life experience. So one thing I'd like to get across to people interested in management is that all management is not operational management. It's quite often the most visible side of management to clinicians. You see your line manager or your director working with targets and finances, but there are all different facets to management. So what I advise a lot of the people I coach or mentor is look at all the different kinds of management, including service improvement, quality improvement, project management, regional strategic management, and go and see those people, have a cup of coffee with them, talk to them about what they're doing. If it interests you, could you shadow them and find out what excites you? Operational management isn't for everybody. Some people thrive and love the busy lifestyle. Other people prefer a different pace and style of work. So it's finding out what's right for you. No matter where you are at in your AHP career, there are lots of different places you can work. The obvious are the hospitals, the social care, education, but there's also places like Health Education England, NHS Improvement, NHS England, and the list is not exhaustive. There's many, many more.